Hi, I'm Crispin, and today's August 8th. I'm going to present my final project on Gaucher disease. Okay, so Gaucher disease is caused by mutated GBA gene that is responsible for the synthesis of glucocerebrosidase. Glucocerebrosidase is an enzyme that helps degrade glucocerebroside, which is a glycolipid in the membrane of cell that is responsible for intracellular membrane transport. So the sequence of the GBA gene is already known and well documented in National Library of Medicine. Scientists have already identified more than 400 mutations associated with Gaucher disease. These include missense mutations, nonsense mutations, small insertions or deletions that lead to either frame shifts or in-frame alterations, splice junction mutations, and complex alloys. And these mutations result in misfolding or decreased stability of the glucocerebrosidase enzyme, leading to its improper functioning. So as a result, there is an inefficient level of glucocerebrosidase, which leads to damages in the degradation process of glucocerebroside by lysosomes in macrophages. So excessive level of glucocerebroside accumulates in lysosomes, unable to be degraded, and it transforms the lysosome to Gaucher cells, which are lysosomes that gain fatty appearance. Gaucher cells and the macrophages affect multiple organs, including bone marrow, liver, and spleen. These affected organs secrete damaging lysosomal enzymes and inflammatory signals to stimulate an immune response to produce scar tissues, which are responsible for many symptoms that Gaucher disease has. So there are three subtypes of Gaucher disease. The first one is type 1, patients with one copy of an N370S mutations plus another mutation almost certainly will have Gaucher disease type 1. Red cell production and white cell production are both lowered in this case, which can result in anemia, associated fatigue, leukopenia, trapped platelets within the spleen, and bone marrow fibrosis, which is bone infarctions due to reduced blood flow in bone and low bone density. Bone infarctions can further lead to physical infirmity, temporary or permanent loss of blood flow, or death of bone tissue. And having two copies of the L444P mutation causes neurological symptoms and is related to Gaucher disease type 2 and 3. So for type 2, in addition to the functions in type 2 Gaucher disease also causes loss of motor skills, decreased muscle tone, muscle spasms, and trouble swallowing. It can also get worse and further lead to trouble breathing and feeling difficulties. For type 3, it can lead to a burst of uncontrolled electrical activity between brain cells, so seizure can occur. So it is heritable in an autosomal recessive manner, so it's not sex-linked. The mutations in GBA do not cause failures at cell cycle checkpoints. Each parent must pass along an abnormal GBA gene for their child to get the disease. In theory, each child of a parent who carries the mutation has a 25% chance of being affected, a 50% chance of being a symptomatic carrier, and a 25% chance of being unaffected and not a carrier. Studies could not establish a correlation between genotype and phenotype, with different phenotypes even among siblings, and also a range of phenotypes were found in 32 children who were all homozygous for the point mutation L444P of the GBA gene. So modifiers and environmental factors could contribute to this heterogeneity. Gaucher disease is also correlated with other diseases. For example, scientists have discovered a negative relationship between levels of glucocerebrosidase and oligomeric alpha-synuclein. So alpha-synuclein is a major constituent of Lewy bodies and a pathogenic hallmark of Parkinson's disease and dementia with Lewy bodies. So if you are a carrier of Gaucher disease, you have a slightly increased risk of developing Gaucher disease later in life, although most patients and carriers will not end up developing this condition. And mutations in GBA1 are now the most common known genetic risk factor for several Lewy body disorders. There are currently no specific preventative technologies for Gaucher disease, but genetic testing is recommended, especially for individuals with a family history of the disease or those of Ashkenazi Jewish ancestry where the condition is more prevalent. Pre-implantation genetic diagnosis during in vitro fertilization for carrier couples is possible. Prenatal screening uses parents' genetic information to determine the overall probability that their child will have Gaucher disease. Gaucher disease is a rare disorder, so it's not part of a routine checkup or general screening. It is often diagnosed based on the presence of symptoms or in individuals with a family history of the disease. A combination of clinical evaluation and tests are needed for the diagnosis. In addition to the general clinical evaluation, a test called beta glucosides leukocyte test is needed. It is the main tool to measure the activity of the glucose cerebrosides enzyme, and patients with Gaucher disease usually have lowered activity of this enzyme. Molecular genetic tests can also help identify biallelic pathogenic variants in GBA to help provide values for diagnosis. There are mainly two treatments for Gaucher disease. The first one is enzyme replacement therapy. It infuses a synthetic version of the missing enzyme glucose cerebrosides into the patient's bloodstream. So it helps break down the accumulated fat in the lysosomes to alleviate symptoms associated with the disease. It has already shown significant benefits in improving patients' quality of life and reducing the size of enlarged liver and spleen. The second treatment is substrate reduction therapy. It does not directly provide the missing enzyme, but instead blocks the enzyme that catalyzes the synthesis of glucose cerebroside to slow down their accumulation in cells. These two treatments have already gone extensive clinical trials and be proven effective. Patients are often found with vitamin D deficiency, so dietitians can provide this supplement to improve the condition. Although there's no standard physical therapy for the disease, physical therapy can also relieve pain by preventing frozen joints and improving ranges of motion. Timely diagnosis and continued monitoring of the disease is critical, especially for type 1, because skeletal involvement can permanently disable patients, and visceral organ involvement can lead to abdominal pain and secondary hematologic and biochemical complications. And for type 2 and 3, which affect the central nervous system, the management is more challenging, but ongoing research aims to further enhance the management. For example, insights into the inverse relationship between glucose cerebrosides and alpha-synuclein have led to new approaches. Unlike the current treatments, which are highly expensive and do not cross the blood-brain barrier, new small molecule therapies, including competitive and non-competitive chaperones that enhance glucose cerebrosides levels, are being developed to overcome these limitations. So in conclusion, Gaucher disease is a heritable disease caused by the mutation in the GBA gene that encodes the enzyme glucose cerebrosides. The production of cerebrosides is then lowered in patients, which leads to harmful buildup of glucose cerebroside in various organs. While there are no preventive technology for this, genetic testing is available to evaluate risks of having a baby with Gaucher disease. And several diagnosis methods are available for diagnosing. Two main treatments are enzyme replacement therapy and substrate reduction therapy, both of which aim to diminish the harmful buildup of glucocerebrosidase. And active research is being conducted to find more efficient and affordable treatment. Thank you for watching, and this is the reference list I used for building this project. Thanks.